Hey guys, welcome back to another video of Heart and Techy. So in this video mainly we are going to discuss about the atrial septal defects. Okay, so you guys can see in this picture, so these are the right heart chambers and this is the left heart chambers. So this is the interatrial septum and this will be the interventricular septum. So you can see there is a small hole or a gap in the interatrial septum, that is in between the two atrias. So this is an ASD, atrial septal defect. So mostly the ASD will be seen in these locations, but there are different type of ASDs, so that ASDs will be like discussing on the upcoming slides. Okay, so you guys can see there is a red color and here is a blue color. So this is a oxygenated blood in the left side of the heart and this is the deoxygenated blood on the right side of the heart. So you guys can see small red color here in the right heart chamber, so that is indicating the mixing of the blood. Okay, so the blood is pushing from the left to right through this defect. Okay, if there is a small is happening, like a small defect is happening, so through the defect blood is going to the right heart chambers. Okay, so what is an ASD? It's a most common type of congenital heart defect. It is the third most common type of congenital heart defects. Okay, and it's giving a contribution of 7 to 8% of the cardiac defects. And there are different type of ASD in which the, as I told you, most of the ASD will be happening in the center portion of the interatrial septum, that is called the secondary ASD. Secondary ASD will be the most common type, and there are some genetic or syndromic association of atrial septal defects. So in some specific syndromes, there are chances for the ASD to be happen is very high. So what are the syndromes? So when we are taking this Haltoram, Noonan, trisomy, Buchiari-Jakulevine mutation and mutation myosin heavy chain 6. So mainly the cardiac sonographers who are doing echocardiography exam in a patient. So if the patient is having any kind of syndromes in one of these, so the chances of the ASD is very high. So there is a syndromic association. So for mainly for the students who are preparing for the cardiology examination or the cardiac sonography examination or for the board examination, I have mentioned a small, like a very short term, which is HDN BJM square, to just to have a reminder about this genetic syndromes. I know, like, when we are mainly preparing for an exam, it is very difficult to remember all these names of this syndrome. For the beginners mainly I'm telling, for the students, so this is a short form. Okay, so H is for the Haltoram and T is for the trisomy, N is for the Noonan and B is for the Buchiari and then J is for the Jakulevine and M is for the mutation of NKX2 and then myosin heavy chain. So as we discussed, so atrial septal defect is most commonly associated in the interatrial septum, and there are some genetic association and there are like different type of ASDs as well. So in the upcoming like slides, mainly we will be like discussing about the type of ASD, and if you are doing an echocardiography in a patient, like in a normal patient or in any other syndrome, so you guys can easily see the atrial septal defects. You guys can easily find out. So we'll see like how. Okay, so in the next slide we are mainly discussing about the type of the atrial septal defect. So as I mentioned to you earlier, the ostium secundum ASD. So this is the most common type of ASD, so which is causing 70% contribution for the atrial septal defects. Okay, and then next one will be the primum ASD, and then another one is the sinus venosus ASD, and the least one and very rarely found will be coronary sinus ASDs. So, fossa ovalis is the center portion of the interatrial septum. Okay, so I'll just draw a simple. You guys can see this is, if this is a right atrium and if this is the left atrium, so the portion in between this will be the interatrial septum, right? So if it is an atrial septal defect, so this is the center portion where there is a fossa vallis. So defect in the fossa vallis is called as ostium secundum AST. So this is the ostium secundum AST portion where the in the interatrial septum the defect can happen, like in the mid portion. So if you guys are seeing a defect or a very small hole in the center of the interatrial septum, that is known as ostium secundum AST. So mostly the interatrial septum won't be like a single plane like this. It's having a multi-dimension. It's a 3-dimension or a 4-dimensional structure. So this is like a just for a easy purpose. I have mainly just draw here. So if you are taking ostium primum AST, so I'll give a green color for the ostium primum AST, okay, in the draw in this picture. So this is the portion where the primum ASTs can happen. That is near the ventricular valves, near the valves, atrioventricular valves. So this is a tricuspid valve and this will be the mitral valve. So secondum AST is here. If the AST is happening here, which is nearest to the atrioventricular atrioventricular valves, so this is called as ostium primum AST, like the antero-inferior portion of the interatrial septum. Okay. Next, coming to the sinus venosus AST, so there is superior vena cava and inferior vena cava which is draining into the right atrium. So if this is the SVC and this is IVC, so in the sinus venosus defects, so the defects can be near to the portion where there is a defect which is happening at the level of the SVC and the right atrial drainage. So this is not the exit portion. So it will be like behind the right atrium. So in that portion, if the defect is associated with the vena cava, this is sometimes it can be associated with the pulmonary veins. So this is like a different concept of the congenital heart defect, which is considered as a complex congenital heart defects, one of the. And then if it is coronary sinus defect, I didn't mention in the slide. So coronary sinus will be draining to the right atrium. So if there is a defect in between the coronary sinus and any portion of the atrium, which is called as coronary sinus defect. So this coronary sinus defect and the like the sinus venosus defect is a bit difficult to find out comparing with the septal defect. So the septal defects can be easily seen in an echocardiogram, but not the coronary sinus and the sinus venosus defects also. Okay. So as I told you, so I have drawn something in the screen. So this is your right heart chamber, right atrium, left atrium, and this is the right ventricle, then left ventricle. This is the tricuspid valve and this is a mitral valve. Okay, so you guys can see this. So there is a small discontinuity in the interatrial septum. This is almost center. So this is known as ostium secundum AST. Okay, this will be the place where the ostium secundum AST can be happen. So if it is a ostium primum AST, it will happen somewhere here near the ventricular valves, atrioventricular valves. And if it is a SVC AST, means so the SVC is draining into the right atrium, so the defect will be happening somewhere here, the portion in where the SVC joining the right atrium. So if the defect is happening in that location, that is called a sinus venosus defect. And the coronary sinus defect means The CS is just posterior to the atrium, so we cannot see actually. So this is a coronary sinus, and if defect is happening like any unroofing, or if any defects which is happening in between this coronary sinus and the atrium, it is known as coronary sinus defect. So what is meant by ASD hemodynamics? ASD hemodynamics means the ASD is mainly causing the left to right shunt, and it increasing the blood volume to pump back into the RA, RV, pulmonary artery, and then the lungs. So that means, I'm just drawing a small rough picture of the heart, not the exact heart. So this is the right atrium, and this is the left atrium, right? So if there is any defect in the interatrial septum, what will happen? So through this defect, the blood will be moving from the left heart chambers to the right heart chambers. So the blood flow to the right atrium and right ventricle, and from right ventricle the pulmonary artery is arising, right? So what happened? The blood flow through this defect, when it is happening, so it will cause dilation of the right atrium, right ventricle, and the pulmonary artery. So it's like an extra volume to the right heart chambers. Already the blood is pumping from SVC, IVs to IVC to the right atrium, right ventricle to the pulmonary artery. So if the pulmonary, when the pulmonary veins is draining the blood into the left atrium, but there is a defect, there is a hole. So through this hole, the blood is pumping again back into the right atrium, so which is causing the dilation of the right atrium, right ventricle, and the pulmonary artery. So the blood flow is like very more to the right heart chambers, so which is causing this chambers can dilate in the later on stage, not in the initial phase of the defect. Okay, so this chambers and this pulmonary artery can be dilated, and there is a relative pulmonary stenosis. So relative pulmonary stenosis means the pulmonary artery, there is a pulmonary valve, right? So to control the blood flow. So there is no issues with the pulmonary valve, but what happens when there is a dilation of these chambers? Lot of blood volume is coming to the right heart chamber, so this volume has to be pushed back to the lungs, so which is causing increased blood through the valve, so it can cause a relative pulmonary stenosis. So the velocity of the pulmonary valve will be more, and then degree and the direction of the shunting is determined by the size of the defect. Okay, so depending upon the size of the defect, there is a dilation. If the defect is very small, it won't cause any dilation, because only small amount of blood will be pumping from left heart to right heart. If the defect is very large, what happen? Lot of blood will be like pushed back to the right heart chambers. Okay, so sometimes what happen in the later on stages, if it is a large defect, all of the blood volume will be pushed back from the left atrium to the right atrium, which is causing more dilatation. And through this defect itself, if the right atrium and right ventricle cannot accommodate more blood in the later on ASD, if the atrial septal defect is not detecting in a person, later on the shunt can be reversed, which is causing the shunting to be reversing. That is also called as Eisenmenger syndrome. So it can lead to the pulmonary hypertension and reversing of the shunt. That is another syndrome which is associating with atrial septal defect. This is very important, so keep it in your mind. So Eisenmenger syndrome can happen not in the initial stage of the ASD, in the later on stages of the atrial septal defect. So natural history of the ASD. So if the ASD is happening, if it is a very small ASD and if it is not causing any of the issues, that is fine. But if in that case like if it is causing any of the issues like chamber dilatation and the pulmonary artery hypertension, when the lung pressure is very high, it will cause symptoms, breathing difficulty, and there are different chances for the atrial arrhythmias, like atrial fibrillation can be happen because of the dilation of the right atrias, and there are like risk for exercise intolerance and paradoxical emboli. So AST is very important in mainly for the neurology related things, because when there is a defect in the interatrial septum, so through this small hole, if any like a paradoxical emboli or a moving small blood clots can be migrate directly to the left heart from the right heart through the defect. So this through this defect, this clot can be go to the left heart chambers through this defect, and then which will be pumping to the aorta, then to the our like through the brain, and then it can cause stroke in like in later on stages as well. So a smaller defect can also, there is a risk for a paradoxical emboli. Okay, so second MAST is very if it is a small one like less than 8 mm, it can be like close in the later on the stages as well. But if it is a primum sinus venosus coronary sinus defect, it won't like close as itself. Okay, so if a baby is found out a atrial septal defect, the doctor will wait in the later on the baby's life, like 1 or 2 years, for the AST to be closed like naturally. So when lung pressures are becoming like normal, and if there is a smaller defect, it can be closed. It will close automatically. But if it is like a very large defect, it has to be repaired either through the percutaneous approach or through the open heart surgery. So in the next slide, we are mainly going to discuss about the echocardiography, classification of the atrial septal defects, and the treatment options as well. Okay, so in this slides, mainly we have like mentioned about what is a syndromic association, what is an ASD, what are the types, only the basic things. So you guys can like rough up and then just revise, and then please wait for the next video of an atrial septal defect. Okay, so any doubts, please do comment in the comment box, and anything we can discuss about this. If anything that has to be improved from my side, that also you guys can share. Okay, so have a good day, have a good weekend. Thank you. Bye bye.